The next portion of our event this morning is our Q&A panel. So we have all 4 of our speakers here still with us during the event. That we're going to switch to a portion where we can ask questions. We want this to be kind of conversational style and informal as possible. So the chat is still open. We'll be monitoring that and pulling questions out and asking the group as well. So any questions that you have, please put in the chat, and we'd be happy to address to any one of the speakers that we had throughout the event today. So to get us started, Dr. Burkham, if a patient does want to come and see you, do they need a referral?
It's a good question. I'm relatively subspecialized into kind of joint pain and non-surgical orthopedics. However, because I'm family medicine trained, my basic training was at Riverside as a family medicine specialist, and I'm board certified in family medicine, which is why I'm here with you guys today with at least discussing diabetes and how that affects our joints. The good news is you don't need a referral. Most insurance companies do not need a referral to see a general orthopedic or sports medicine person. If you need to go see a surgeon, sometimes they will require a referral. But for most people, you can just call the office to see myself or one of the other doctors around in your community, whether it's a sports medicine specialist. That's what I would look for, because it can really help you, and they should understand how it affects your joints with the diabetes because of their family medicine training, but then a little bit of that additional expertise into joint pain.
Excellent. For the other clinicians that are here as well, we're at the McConnell Heart Health Center and Barb's at the Delaware Health Center, so we're available as well. So talk to your family physician if you would like to get connected with a dietitian, or reach out to our program as well at McConnell if you're interested in accessing the exercise physiologists and the dietitians on our team. Okay, great. Alyssa, you mentioned glucose tabs that can be used during an exercise plan. Where would you go and get tabs that you could use during exercise?
You should be able to find glucose tabs or gel at most pharmacies, and that's probably the best place to look to find them. Barb picked these up yesterday for 99 cents. So not very expensive, easy to take with you, very portable. You can more customize how much carbohydrate you have. 4 of these is actually 15 grams of carbohydrate. So depending how much you need, you can customize that, and they act really quickly. So that's a convenient option for low blood sugar to keep with us, really, in any situation, but definitely during exercise.
Yeah, excellent. Affordable, gets the job done quickly. Do you know how they taste? Do they have flavor?
Sweet. It's almost very sweet, actually. Sometimes you might be too sweet, but yeah, if you want a little sugar.
Excellent.
Yeah.
There's fruity flavors, raspberry, orange.
Perfect. Something for everybody, right? Okay, we've got a question here in the chat that I think probably is going to anybody on the panel, but probably Natalie. Do you need to do all of your exercise all at once, or can you break it up throughout the day?
Yeah, great question. We're super busy. People have a hard time finding the time to do a big workout, and actually may feel more overwhelmed about doing all of their workout at once. So it's really beneficial to break that up. Say you're going to do the recommended 30 minutes. You can do 3 10-minute walks. You can do 3, little short videos. So definitely breaking it up. It also breaks up our sedentary time, which is what we really want to reduce happening, is seated for long periods of time. So that's a great question.
Yeah. When we were doing the chair aerobics, I sit at a desk most of the day, and I was thinking, gosh, how great would it be to kind of break up and a little times throughout the day, get up out of the chair, move a little bit more, would have a big impact at the end of the week.
And even looking at, like Dr. Burkham, you can attest to, when we are seated, things get tight. Our ligaments, our tendons, and that's why it hurts a little bit sometimes when we stand up. So breaking that seated time, both for metabolic reasons, but also for the fact that our tissues get very tight and then they hurt. So thinking about maybe even getting up every hour and doing some sort of movement is a great movement goal.
Mm-hmm. Great. Yeah, I've heard that, sitting is the new smoking, right? Mm-hmm. We've heard that phrase. I don't know, anybody on the panel want to talk about that and maybe what that means when we hear the phrase sitting is the new smoking?
I think I'll just answer a little bit to the fact that there are a lot of comorbidities that we can actually incur or worsen by being seated for long periods of time. And so in that way, it almost rivals some of the, problems with smoking and tobacco use. So they are different. They're two different types of behaviors, being sedentary or smoking, but they both can have very, very, very poor consequences on our health. So I think that's where that. And there is a book out there that's called Scared Sitless, which I thought was a really cool kind of title, and it's written by a physician. But there's a lot of research now to look for and to find out exactly what we can do and just the dangers of being seated.
Something I've heard you say before, Natalie, that I always remember is just if you go and maybe do a more intense exercise session in the day, you have that. It's still important you don't sit the rest of the day.
It's very true.
Yeah, it is sort of sometimes a risk, like when you pushed yourself and you're like, okay, now I'm done. I can just sit. But how important it is to just move our bodies every hour and avoid sitting long periods of time.
It's a really good point, and I think a lot of people do think that way. They get it in, they feel great about it, and it is great to do a big workout. You're challenging your body in a different way, but it does not give us the leeway to be completely inactive and watch Netflix the whole rest of the day. Tempting as that can be, but yeah, really good point.
And I think,
go ahead.
I was just going to say, from a blood sugar perspective too, when we move, that's when it does help lower our blood sugar. So, and that lasts for a couple hours, but that's only a couple hours. So we need to keep moving all day to keep getting that benefit all day.
Yeah, like Tim said, being in an office, you have to strategically decide when you're going to stand up. So I have two online patients in a row, and then I have an in-person so that I can then stand up during the inpatient. So I try to strategically think about that too.
And on that note, so many people are home working, and when you work at home, we don't have big long hallways that we need to walk to use the restroom or to get up and fill our water bottle. So it's really been removed from our lives in so many ways, doing so many things remotely. So it's a whole nother really concept of what we should be doing and how we can fit that in.
Yeah, I think about too, Dr. Burke, and what you were talking about earlier, kind of the wear and tear, the analogy to the car, which makes a lot of sense, and I think you can visualize the wear and tear on your joints throughout the day. There's probably also, if you're doing a really hard, intense, high impact type of activity, it's going to wear a lot more than if you're doing lower intensity, but periods throughout the day. Do you see patients that, I'm assuming, want to get back into exercise and maybe they go too quickly and they do too much too soon and then show up in your office with joint pain?
I think that's kind of maybe one of where patients they feel like physical therapy didn't work potentially. They go a little too hard too fast and kind of jump into it. I think that it's important to have a good plan and a good understanding of where you are fitness-wise, maybe blood sugar-wise, and everything, so you have a good plan going forward. To piggyback on kind of the conversation they were having about, going from the seated to standing position, I have a lot of patients, especially in the winter months, who I really encourage them to have a heating pad near their favorite chair or where they sit, or even by their bed if they wake up with stiff joints in the morning. Because I have a lot of patients who their first steps out of bed or the first step off the couch to get up and go to the kitchen or go to the bathroom can be very painful. And our joints do get tight. And actually with arthritis, as the joint narrows, they actually call it the gelling effect. The joint lubrication that we all naturally have in our joints actually, as the joint gets really, really tight, can become stiffened and painful. It's not just the tissue, it's actually the fluid in your joints. So a relatively easy trick. And some people love icing their joints or using heat, and everybody's a little bit different, but I find heat, especially for tight tissues or tight joints, if you put a heating pad on that knee, or on that hip, or on that ankle, or wherever you may have some discomfort, or even on your low back, and do some light stretching, right? Like we were just going through some of the exercise physiology stuff, some of the chair aerobic stuff. If you heat up that joint, do some very light stretching first to get the joint mobilized, and then get up and move, the pain can be dramatically reduced. And then you don't have that kind of scare or concern or frustration, like, I don't even want to get up because it hurts so bad. Because that can kill your motivation to get up and do what you need to do to keep those sugars lower. So I find like there's little tricks like that can really help. So I think the heating pad to help loosen up the joint can be very helpful.
That's a great tip. Yeah, right? If you know that that's going to be a barrier to moving, have a plan to address it, and you're gonna be more successful. So keep it along the topic of motivation. Natalie, do you have other tips or tricks? If you know up here that you need to exercise, you know it's going to be beneficial, you know you actually feel better after you do it, but you're lacking the motivation. Anything that you can think that can help?
Yeah, I mean, and we've talked a lot this particular month within the program that we all work in to habits, and how sometimes it's just building that habit. Motivation may not 100% be there just because I'm not sure where it comes from. You know, it has to be of something you've got to really enjoy what exercise you're doing, and then find ways to build that in using triggers, such as possibly, you know, putting it in your calendar. I use a password that is related to fitness, so it's always in the forefront. Leaving your things out right where they should be. They remind you, you know, whether it's your workout stuff always in the same place, and, you know, not having your another big barrier would be having your treadmill used as a clothes, you know, butler, which a lot of people do. I mean, you're setting up barriers that way. So kind of figuring out what's a good trigger to get me going, and then, you know, potentially reducing the ones that are keeping us from it. It's a behavior that, you know, is so great to add to your life, but for some reason it seems like a very difficult one to embrace. So approaching it also very realistically in your goals, thinking I'm going to, you know, do some form of activity 2 times per week and build on that. When people think I'm going to get up at 6 o'clock in the morning and I'm going to work out for an hour, you know, that's just kind of setting ourselves up for potential failure and frustration. So really keeping it real, like Dr. Burkham was saying, what is your level, what's an appropriate activity, and you're going to feel more motivated because you can achieve it as opposed to feeling like you didn't do what you set out to do.
That's great advice. If you are going to set small goals throughout the day, kind of break it up and have little activity goals. This question came into the chat that Barb, I think, was part of your talk about checking blood sugars. So if you're going to do 3 10-minute walks throughout the day, do you need to check your blood sugar each time?
At least check in with yourself. So maybe, everybody's different, so maybe a 10-minute walk for you is brand new exercise, so it certainly wouldn't hurt. However, I know that you only have so many test strips allotted to you from your insurance company. So if you cannot test, you might just at least check in with yourself and how do you feel, you know, and do you feel like you can make the 10-minute walk? So I guess that's an individual question or individualized answer, but so yeah, it's kind of an individual thing, and how many test strips you have, but do what you can.
Yeah. And I think part of your presentation, you may have mentioned that if you're starting a new program or if you're new to it, that you might need to test a little bit more frequently, but over time, right, that as you know how your body's going to react, that you may not need to test as frequently. Is that true?
Yes, and I was thinking also it depends what medication you're on. You know, if you're on insulin, it might be more important to check before and after each of those 10 minutes versus if you're on just meal plan controlled diabetes, you may not even have to check before and after that many, you know, all 3 10-minute sessions. So, yeah.
Very good. Alyssa, do you have other examples of protein shakes that somebody could use after exercise?
A lot of protein shakes in the market are only sources of protein. They don't have carbohydrate as well. So I would really encourage you to look at the food label of the shake you're getting. A couple that are really common on the market, a lot of people use are the Premier Protein or the Ensure Max, that are kind of designed to be like a lower calorie, high protein shake, which is a great place to get your protein but doesn't not provide the carbohydrates. So if you're looking at your food label and you notice protein is 20 grams but carbohydrates are 2 grams, then that would be, if you're using that for a post-exercise food, then have the shake and some of these carbohydrate sources like a piece of fruit or a few crackers, you know, to go with it. And then some are more balanced, like the ones made for people with diabetes actually have both carbs and protein, so those would usually meet your needs. Slim Fast is a popular one, and it's a little bit more a little higher in carbohydrates, a little lower in protein. So that's why I gave you those grams. If you have food labels, you can look back and say, am I getting the right balance I need? And if this shake is higher in carbs or lower in protein, maybe I'll add that cheese stick or a little turkey or something with it to balance it out.
Perfect. Dr. Burkham, I know there are a lot of questions around cortisone shots that you get a lot in clinic as patients are coming to explore that option. Do cortisone shots cause weight gain? Is that a consideration?
It's a good question. I mean, the side effects of cortisone shots are kind of a very common topic, and I don't know if you guys in your diabetes and kind of weight management situations sometimes get those questions. So prednisone, we talked about the pills or the Medrol dose pack. Steroids can definitely increase appetite. So, and then there are many stories about weight gain on steroids, but we use steroids in lots of other areas of medicine, right? So with anti-rejection drugs for transplants or cancer treatments and other things where you'll see people do gain weight. Those people are on steroids for months, right? The actual long-term weight gain is not something we see with cortisone shots. Even short bursts of a prednisone pill from your family medicine doctor, talk to your doctor when they prescribe it. But if you're aware that your appetite's going to be up, I mean, we have these awesome nutritionists, dietitians talking to us about healthy snacks. I tell people, if you have some carrots, if you have some celery, if you have some, I always go with the low-calorie popcorn, something where you can have a good number of bites because your appetite is up, but not take in high numbers of calories. You guys tell me if that's bad advice. But those are the type of things that I like, especially like celery, right? Because it's a lot of water-based. So you're not getting a lot of calories, but you can actually have that increased appetite and not have a major weight gain. So cortisone shots, it's not even a concern. You do have the increased blood sugar, you do have the increased blood pressure for a short period, but increased appetite is extremely uncommon with a cortisone shot. But be careful with the pills because you can have some increased appetite and maybe small weight gain if you're not careful. If you eat too many Girl Scout cookies, like my daughter who brought all those home recently. So
That's great. And staying on that topic of the shots, you said that results could last 3 to 6 months potentially. Are you able to come back in and get another one as it starts to wear off? How frequently can you get it? How many can you have over the course of time?
good question. I do get that a lot where people are like, well, how many cortisone shots can you have in this joint, right? Is there a limit? I always heard there's a number. I get that question a lot. And it's interesting because we talked about patient selection with a lot of the different injection options. The hard thing here is that everyone's unique. If you're 85 years old with joint arthritis, there's clearly no limit. If you are 35-year-old weekend warrior exercising, clearly we want to avoid cortisone because it's not healthy for the cartilage you may still have. So very, very different. But actually there is no number or limit on cortisone shots. I tell people I don't want to do a cortisone shot every 3 months like clockwork. If we can avoid that, that is ideal. We want to try to use the other things like the physical therapy, like some of the just home aerobics, chair aerobics, home exercise program things you can do to offload the joints, to lengthen out the benefits you get from any injectable treatment. So yes, we want to avoid it every 3 months, but there isn't a number. There isn't a set number. It's individualized for each person. There are reasons we stop. If you get a cortisone shot and you get less than 3 months of relief, I don't recommend doing another one. I recommend we try something else because that cortisone shot did not last long enough, and we need to see if there's something else could last longer and give you a better result.
Fantastic. Melissa, when you were talking earlier about preparing for activity and pre-planning your snack, you mentioned golf, which I know, Dr. Burkham, you're a big golfer as well. I love to be out on the course, right? And a day like today when the sun's starting to shine kind of gets me in that mindset. And I'll admit, guilty pleasure, I like at the turn, after the first 9, grabbing a Snickers bar from the clubhouse, which is probably not the ideal snack. So I really like that advice to plan ahead, take something with you, throw something in the golf bag that is a healthy alternative. It's going to help you because you do start to get fatigued after some activity. It's going to boost that energy back up. So what are some good snacks that I should throw in the bag and take with me if I'm going out for a round?
So when you're out, say, on golfing or hiking, you have that long period of time, you do want to try to have that balance, the carbs and protein like we talked about. So I think a lot of these things I brought would be examples, but not all of them are realistic if you're out for a long time. So something that doesn't need refrigerated. So I like the trail mix for that reason. and the some of the bars are convenient. You know, they're easy. If you're going to eat it within 4 hours out of the refrigerator, like a half sandwich can be appropriate. But we always use that 4-hour rule. No, don't have it out of the fridge longer than 4 hours if it is perishable. 'Cause a lot of the ideas I had were perishable. One thing that you said about the Snickers bar, I want to make a comment about, which is actually.
She's ruining our golf round.
I'm not though.
Come on,
See,
no,
here's the thing. You want to be moderate with sweets, but I think it's important to have a healthy relationship with food. There's no food we can never eat, right? So one, you might get like a mini Snickers because that's a way to enjoy it.
How does
Smaller
that
way.
feel, Tim?
I can do that. Maybe some peanut butter crackers and a little mini Snickers. That
Yeah,
would be great.
the peanut butter crackers would be balanced with the carbs and the protein. That's good. But honestly, like when you exercise, it's probably one of the best times to eat something with more of a dessert type of thing because our bodies are really burning up that fuel better. So in some ways, it's kind of a, it's fueling the body with. You want to get good nutrition, but when we eat sweets, it makes sense to do it around a time that we're burning up those carbs, if that makes sense. So,
I like it.
yeah.
Snickers approved on the golf course.
That's what I
Not
heard.
right before bed, right?
Yes, absolutely.
It's probably not going to give you as much you're not going to feel as good and energetic for
Yeah.
performance with a Snickers as you would for some of your healthier things, but
And maybe that's why the round starts to go down and the
it.
back nine, right? I always blamed it on my own personal abilities, but I'll blame the Snickers.
I
now.
feel like too on that, when it comes to nutrition with both of you guys, there's so many options and so many promises, and you know what I mean, that for the consumer to be making really good healthy choices is difficult when it comes to the bars and just my take on that. I think that's why people might struggle a little bit.
yeah. Fruit is like nature's most portable, healthy snack. That's always a nice option too.
Yeah,
Nature's candy.
that's a good idea. Throw an apple.
An apple and a 100-calorie nut pack, maybe.
There you go.
Perfect. Okay, anybody from the group have questions for each other or anything else that maybe you didn't get to touch on during your talk that you think would be good for the group? We've got a couple minutes left before we sign out.
Gosh.
I have a question.
Yeah.
So if I have patients who don't necessarily want to go through a whole weight management program, but they would want to meet with a dietitian, I'm still curious of what's the best way to schedule, whether it's online, whether it's calling an office, because I think that's something that I probably under-refer, right? Because I've had these conversations if there's a problem, but we can all benefit from this. Like Tim and I talking about golf. I mean, this is something that we all probably need to discuss. And I probably don't talk enough about all my patients. We tend to deal with things once it's a problem. Like we talk about the car analogy. So if people wanted to kind of be proactive and meet with you guys, whether it's digital, I mean, probably the Zoom stuff with COVID has improved our, online digital scheduling. How would I send my patients to come see you guys?
Really, anyone can meet with a dietitian. At McConnell Heart Health Center, we have what we call a clinic, and I think Barb has something similar in Delaware, where basically you can come to us outside of, you don't have to be in one of the programs to see us. So we do like you to have a physician referral or a doctor's referral because that way we're a team. We're communicating with your provider and we're all on the same goals. But you can come see a dietitian really for any reason. And if you, I would start though with getting a referral from your doctor. They'll send it in and then we'll reach out to you to schedule. There's dietitians all across the community in terms of, Ohio Health dietitians, and if you're living outside of Ohio Health range, I'm sure there's dietitians in your community as well. We'd love to have you come in.
Would you just Google search Ohio Health Nutrition or dietitian? How do I search that?
Well, we were looking into that a while back, some of the outpatient dietitians, and it's not always as easy as you think. But a lot of the hospitals, for starters, have dietitians that do outpatient work. For example, living in Delaware, I was looking at this for another reason, but there is a dietitian at Grady who sees outpatients on Tuesdays. And then there's also a wonderful program within Ohio Health called the Comprehensive Diabetes Program. And within primary care doctors' offices, certain offices, they have dietitians that will see their new diabetes patients or patients with hemoglobin A1Cs over 9 So they're really working as a team together to help the patients with diabetes. So then, but at McConnell in Delaware, these clinic patients are scheduled just through the referrals within the Epic
Okay.
Yep.
computer
Probably asking your
system.
primary care doctor is the easiest way, but
Yep. Start with your doc. I think that's a great place because for it to be covered by insurance, we do have to have a physician referral. So getting a referral from your doc is an important step. If you have diabetes, it's probably going to be covered. It's well covered if you do have a diagnosis of diabetes. And I threw our phone number in the chat, so it's the phone number for the McConnell dietitian team. So if you have any questions, you can call the number, and we can help you through that process of getting a referral and getting scheduled for that appointment.
cool.
Okay, well, we're so grateful that you joined us today. We are recording this event. We'll make it available afterwards. So if you want to go back and look at some specific points that Dr. Burkham shared or any of the other speakers shared, if you want to get back in and do the chair aerobics routine again, that'll be recorded, and you can do that multiple times and do that as well as other online resources. We can't see outside from the studio right now, but I'm hopeful that it's sunny out. This is a perfect day in Ohio. That if you're motivated after this talk and you say, you know what, I'm going to get out, start small, go for a walk, enjoy the sunshine, this is a perfect day to do it. So thank you again for joining us. Thank you to all of our speakers. We enjoyed the presentations, learned a lot. I learned a lot. And we hope that you'll reach out and contact us if you think we can help you further. Thanks, and have a great day.